Friends and birth peeps, Augustine here. Before we begin today's episode, I want to share a rare opportunity with our midwifery community. Midwifery Wisdom Collective is currently acting as a connector for a fully operational, purpose built birth center for sale in Abilene, Texas. This opportunity is available due to the owner's planned relocation, not because the center is struggling. It actually has been very successful, sustainable, and it is deeply needed in this community. This is the only birth center serving a 2-hour radius, located just minutes from a level 2 NICU hospital, in a region experiencing a real shortage in maternity care providers. The center has been profitable as a solo practice, and it has clear potential for growth, particularly for a CNM or group practice because of the high military population billing TRICARE. If owning, expanding, or stewarding a birth center has been on your mind, or if you know someone who's been waiting for the right opportunity, we invite you to get in touch. To request more information, including a slide deck and sales presentation, please email Amy at midwiferywisdom.com. That's AMY at midwiferywisdom.com. You'll also find details in our show notes. And now on to today's very special episode. Welcome to the Midwifery Wisdom Podcast. Ashley, tell us who you are, where you are, and what you're all about.
My name is Ashley. I reside in Michigan in the US, and I am adventuring on this journey of hopefully becoming one of the upcoming major change agents about realizing and honoring birth trauma, but also just change that can happen and in my opinion needs to happen within the birth world and just how we treat people, quite honestly.
Gosh, yeah, let's put a big exclamation point on that. When you say the birthing world, I'm assuming you're not just talking about obstetric violence, but you're also talking about the world of community-based midwifery.
Yes, in my own opinion, co-care, collaborative care, all combinations of care are the best way to treat women and to minimize birth trauma and to create good equality care throughout the broad span of birthing people. And I think that really needs to be brought more attention. I think we've gotten so focused on medical advancements to treat and help those that have major complications or challenges within pregnancies and birth, which does need to be worked on. But I think within that, we've lost the aspect that not all the time is that the case, and birth can also just be left to unfold. And if there are some not as advanced challenges within the pregnancy, birth, postpartum, there can be a lot less of a major hands-on approach, and little things can happen first before all the big things, and that can make a big impact on the psychological aspect of the woman and the family and whole process.
Yeah. I talk about this a lot, the balance between art and science, between medicine and midwifery, between head and heart, right? Like we're finding that balance. And it seems historically the obstetrical world has been over interventive and the midwifery world has actually been under interventive. A lot of the cases that I see are really a lot of needless suffering and lack of action. And then, of course, everything we hear coming out of the hospital is that they're jumping to cesarean or they're recommending induction or what have you, right?
Yes,
Well, so
absolutely.
let's talk a little bit, let's narrow in on the community-based space, because obviously this is who most of our listeners are, and obstetric violence is really a problem. And I know we're going to touch on that in a bit, but let's focus on the community-based space. And can you tell me what resources you feel like you have seen or advocate for or are concerned about?
Yeah, so something that's really big to me is, especially here in Michigan, so there's primarily a major focus for in terms of community-based birth. It's mostly CPMs in this area. We actually had, as of almost 2 years ago now, we have our first CNM in the area, which was amazing to me, and I absolutely love her. She's been fantastic. And that's comforting, was more comforting in a way for me for my second birth. I had a lot of challenges with my first birth. And so to have someone with a little bit more knowledge, so to say, and a little bit more experience, she really matched my background in terms of experience before going into her master's for midwifery. We were both former ICU nurses, had a lot of similar backgrounds, so that made me very comfortable in going on a new journey. But she's done a lot of work also with the CPMs in this area. And even in talking to her, for me, a big thing is talking about home birth transfers, community birth transfers, things like that. And the respect that sometimes is lacked severely for her colleagues from the CPM standpoint that she doesn't experience all the time as a CNM. That was very interesting for me to hear about how they are treated so differently sometimes.
Can you give me an example?
I guess for me, something she relayed was that her thought process behind it is sometimes CPMs that might not have access to or as much of a background or training in the community birth setting. When things go wrong, sometimes there is a delay or not caught, some inklings to a situation going on. So in her thoughts, she was thinking it might be more related to they sometimes drop off more so complicated, more urgent patients in a delay of transfer, whereas her transfers, she thinks typically are usually more ahead of that time frame. So that was something she kind of thought about as to one of the reasons maybe why is that not that she hasn't had to bring in super urgent medical transfers, but most of the time they're before that happens. And then also just her background and being able to have a lot of
Well,
that medical experience.
this is a common juxtaposition between CPM and CNM world. And it's also one of those really scary and kind of swept under the rug realities. And the fact of the matter is, one of the reasons the mainstream obstetrical world is so afraid of community-based birth and community midwives is because of these quote unquote train wrecks that keep popping up in the hospitals, that the receiving physicians and oftentimes receiving CNMs are receiving clients who they, in their opinion, is a delay in transfer. I just did a really extensive charting updates course and talked about midwives who are being arrested, jailed, sued for very poor outcomes. I think this is kind of a systemic issue. Certainly parts of the country have it worse than other parts, but I think it's a real theme where the attempt to try to have that normal birth, to meet the client's needs, to have the experience that everyone wants to have, that potential is held in higher regard than the realities of the vitals that they're taking, or how this situation is unfolding, and it ends up being a real crisis. And then that client, aside from the crisis of their actual medical health, they do experience quite a lot of trauma because of that transfer. And that brings us back to this concept of having collaborative care. So tell me more about your ideas or your experience, what you're hoping happens.
Yeah, so my first birth, I actually requested the transfer, and I'm very glad I did, because if I didn't get to that point beforehand, we would have ended up in a not as great of a situation. So unfortunately, regardless of my trauma, honestly resulted more so from just the treatments of the receiving hospital that I went to. And unfortunately, the biggest thing for me was always like, it didn't have to be this bad. Like the situation was unfolding, but it was going slow enough that with proper communication, care, compassion, empathy, it did not need to have the impact that it did. With my second baby, I developed my care team probably just about a year, honestly, before even conceiving my second child. I was very compassionate about having a plan and having a very experienced, thorough team who was going to do as much as they could to get me my experience that I wanted as a home birth. but also be very realistic and honest and be able to give me comfort of if something does happen, it's gonna be okay. So I spent about a year developing that team. I found an amazing doula who's got years and years, hundreds of births of experience. Previously had a background as a licensed therapist doing like marriage counseling and things like that before going into her doula work.
Beautiful.
And then I found an amazing hospital system on University of Michigan who has a very extensive nurse midwifery team that's very well respected by the OBs in their department. Even their high risk service has nurse midwives as part of their team to be able to provide that midwifery care and approach, which to me was
Beautiful.
huge. So, and even when I brought up the idea that I was going to attempt to have another home birth, the midwife there at University of Michigan, she was like, that's fantastic. That's great. And I was honestly very shocked to hear that
Love
reaction.
that.
But she was like, if something happens, we're here. I found the nurse midwife who had moved, this is actually her home state, but had moved here back with her family. And I was actually looking for doulas the night that I came across her site. And I was like, this was meant to be. This is who I am going to have. So we went through all of the things. When I originally talked to her, I quite honestly wasn't even determined on if I was going to go the home birth route because of my future experience. But to me, I approached with her of, would you be open to going down this future journey with the possibility of doing a home birth, but also the possibility of me deciding that I just want to have this child in the hospital. And I want you there as a support person and my personal advocate, free of bias of the system, to go over all the things. And also that has, a continuity of care that for me was huge. I was never anyone who wanted to be able to go into a hospital and not know who my provider was. So we
Beautiful.
ventured down that journey with that being all the options. And to me, it was huge. There's not many midwives really that I've known of, or even my doula knows of, that would be willing to kind of start a journey with the possibility of not even actually having a home birth. So that was huge for me. So I had kind of the unicorn of a team that I found.
Amazing. And will you tell us how that unfolded? What happened for you?
Yeah. So my 20-week ultrasound for my anatomy scan, it was done at like a not hospital related place. So their radiologist ended up reading the ultrasound read as like a complete previa. And also there was some echogenic hyperechoic spots on the intestine and bowel of baby. So they referred us to the maternal fetal medicine, which was at University of Michigan. So we went there. Thankfully, there wasn't actually any previa, so we don't really know where that came from, but there was still the hyperechoic and echogenic spots. So within that and researching all that, preparing for that scan and realizing that I potentially, if there was previa, thankfully there wasn't, but that would basically more so potentially very likely mean another C-section. At first, that to me was very triggering, but then it was almost this weird sense of solace in a way. And very early in some ways of this journey, I was like, I don't know what that tells me feeling wise. I had been doing a lot of EMDR, a lot of work to like figure all these feelings out throughout the process. That was something we did talk about, but thankfully that wasn't an issue, thankfully. So, but we did continue to follow up with maternal fetal medicine throughout the course of the pregnancy. Follow-up scan for that showed that those spots did actually resolve, and there was not a concern at all from maternal fetal medicine about those. Repeat scan, though, did show that one of the baby's brain ventricles was borderline of being too large, being too big. They recommended we follow up on that, which we did after everything with my daughter. I was like, I don't want to have to transfer and then anyone have any sort of stand to be like, well, you didn't follow up on this, because that was one thing that was brought up with my daughter, was something that was pretty minimal in relation. They were like, well, you didn't follow up on this. And I was like, that has not really anything to do with this situation. But that was my thing. I was like, I don't want anyone to be able to tell me I didn't do something. So we went back, the ventricles balanced out. That was not an issue at all, but it did then show polyhydramnios, and baby had been having an unstable lie throughout this whole time as well. So towards the end, it was probably around 34 weeks or so, I started talking to my home care midwife, my co-care U of M midwife, and kind of figuring out a situation, because while they were like, a lot of times people can still have VBACs and stuff with the polyhydramnios, my biggest thing was protecting a good experience. I really, really wanted my home birth throughout the kind of back and forth of things resolving, things popping up. It was always, do I qualify? I, throughout the journey, did end up feeling like I really did want my home birth. I felt very comfortable in my team and our plan. So that ended up coming very important to me, and was almost a process that I had to grieve in a way of realizing that it was starting to slip away again of not having my home birth. But with everything, I was like, my biggest fear is going into labor and something happening and there being another bad outcome or a bad result or bad experience. So my whole time I had been telling my birth team, I really want this VBAC, but my biggest, most important thing is a good experience, regardless of how this baby's born. So we started really talking about what that through University of Michigan. Every appointment I advocated to my co-care midwife. I was like, my biggest thing is I want my baby. I need my baby. There is not really any sort of a reason why this baby needs to go to a warmer, as long as they have good ABGAR scores when they're born. I was like, I need my baby. That was the biggest, most important thing to me of healing, was my messy vernix covered baby straight on my chest. She was like, we can most definitely push for that. She's like, I can't always guarantee that, depending on situation, circumstance, that we can make it happen. But it was flagged all over my chart. I saw it, big capital letters, baby needs to go to mom. That was huge to me. I made it very clear that I need to know what is happening and why it is happening. And if I'm being told no, why? Whether it's just as simple as because that's our policy, or another reason, I need to know why. Because last time I felt like I was just being told any sort of a reason that would hopefully just make me content and happy. And I was not standing for that. I was like, I need to know why. And so she really made sure that happened for me. And that was huge, because I felt like with my daughter, I tried very hard to advocate for myself, ask questions. Things to me did not feel right. And I just kind of felt like I was being annoying and overstepping my boundaries of what I knew and didn't know. She made sure everyone knew that if we transferred, whatever the situation may be, that like I need a good team. I was like, I am not working with little baby residents. I don't care how nice or good they are. I was like, I want the fellows, I want the attendings, I don't want brand new baby nurses. For me, that was a little hard because I have a background. I worked in ICUs for just about 5 years. I know what it's like to be a new person and to learn and to have that experience. But to me, someone who's experienced trauma, that's not the right person. And to me, that needs to be respected and appreciated.
And that's so clear. It's so important. Gosh.
Yeah.
Well, so you got to do something kind of revolutionary. Do you want to tell us the story?
Yes, I was in a really, really tough spot, really just about all the way up until the last 2 or 3 weeks of my pregnancy. I ended up deciding that I don't want to try the home birth thing. I don't want to wait for spontaneous labor, realizing what that meant in a way for VBAC success. I was like, I want a 39-week induction. I want things planned. I had a step-by-step plan of how I wanted my induction to go. that would give me, I came up with it with my doula, my midwife, everyone. I was like, I realize this doesn't necessarily give me the most success for a VBAC, but it gives me the most control. And that's what I need. To me, I felt like my U of M midwife really, really was, understood everything I was feeling about not being able to get my home birth, and also the lack of trust in just the system and the process. And I have heard many amazing stories from so many women that have had births here at U of M. And to me, that still didn't matter because of my own previous experience at another institution. So my midwife was great. I actually honestly asked her, I was like, listen, my community care midwife's going to be there. I was like, can she be my conduit during this induction? That was something new to her. She was open to it. And I greatly appreciated that, because I was like, I don't want this. You come in, you talk to us, we talk, then you come back, we talk to you. I was like, it just messes with everything. And I was like, she knows me. We spent 9 months plus talking about everything. And I trust her. I was like, nothing against you guys. You can be the greatest. I don't trust you. I was like, unless you give me a reason to. And obviously, with the way things work, I can't guarantee that my lovely midwife from U of M was going to be the one there during the day of my induction, or potentially still on shift by the time baby was born. She was like, I hear that. She's like, I think we can make that work. So I was like, great. And then I went in for my next visit, not the most comfortable, but was there. And she was like, listen, before we even start this visit, she was like, I have something to offer you. And I was like, okay. And she was like, so we've only done this now twice. So we were the third, but she was like, would you be open to a maternal assisted C-section? And I got tears in my eyes and I kind of froze, because before I ventured on this whole journey, I had seen posts from the first one they had done, which was just about 6 months after my daughter was born. That was actually a big trauma hit for me, because I was like, I advocated for not this full experience, but I advocated for some of the components of it. And I got told no so many times. So it was a big hit to the gut, what I saw there first. But to be offered it, I felt so surprised and in awe, because it meant the world. And I was like, you know what? She's like, you did this. And I was like, I advocated, believe me, I did. Every single visit, I said how uncomfortable I was and everything. But I was like, you brought this to their attention. I was like, I did not go seeking out this physician. I was like, you advocated for me. And to me, that meant the world. Of you not only listened to me and empathized, you went the extra step to advocate on my behalf, realizing everything that I had gone through in the past. And I
Find a
remembered,
solution. Yeah.
yeah, I remember her saying, like, okay, so do you feel like you're in the right mindset to sign consents right now? Or we can wait, but we like to have them beforehand. It just helps, speed things along, understandably. I was like, I will gladly sign that C-section consent. And that is nothing I ever thought I would ever say in a million years. And I was just
Wow. Wow.
shocked. I was like, I can't believe this. I called my doula, I called my midwife. I was like, for the first time in months, I have a plan that I am comfortable with. And there was a little bit of me at the time, all the way up until my son was born, that was like, is this going to give me that same redemptive feeling of my VBAC or of a home birth? Honestly, I think it gave
Mm-hmm.
me more, because when my son was born and he was right on my chest and everything, I was like, you know what? This shows me that, well, unfortunately, it is not the norm. And unfortunately, so many people don't get this. It does show me, though, that there is a better way this can happen. And it does not always have to be that way. And that's, C-sections can be healing. They can be redemptive. They can be everything, especially to
Yeah.
someone who's had trauma.
Yeah.
And everyone from the surgeon, who I honestly didn't even meet her
Well, can
until
we
the
go
day
back and
of.
for people that
Yeah.
really don't understand, tell us, really explain what is mother assisted? What is a MAC?
Yeah, so a mother-assisted C-section is where I think the best way is honestly just explain how it went for me. So I was in the pre-op area after I got there for the birth of my baby, listened to baby, all the things, got ready, got back to the OR. The surgeon met me in the pre-op area. She did not leave my side from the second she showed up right before the case started until after my baby was born and we were in recovery. She came up, she held my arm while the spinal was being placed in the OR. I sat there, they did my spinal. I did need to be grounded a little bit because I was like, I want to feel all the things. The anesthesiology team was amazing. It was almost like a paternal effect. To me, I felt like I was everyone's either daughter, spouse, sibling, family. Like that's how well I was treated. So while they placed the spinal, I was able to have a support person with me from my own side, but the OB, Dr. Kathleen Mahari, she did not leave me. She was rubbing my arm the whole time they did the spinal. After the spinal was placed, they laid me down on the table. They started doing all the surgical prep on the abdomen for that. And while they were doing that, they had me put the hand cleaning gel on my hands. And then they placed surgical gloves on my hands and surgical sterile sleeves on my hands. They put a sterile, basically baby towel on top of my chest, and that's where I rested my hands. There was no drape at all in the beginning of the case. So I could see the surgeon. I could reach out and touch her if I wanted to. I could see everything to an extent. Had a big belly, so I couldn't actually see. I asked though, I was like, is there a mirror or something where I can actually see? And they were like, no, sorry. But so I laid there with my hands across my chest on this sterile towel, so excited.
Well, that's a good
Um,
idea, though. They should add mirrors. I love your idea.
yes.
We have
Um,
mirrors for vaginal birth. Why not? Yeah.
I know, they're like, I don't know if anyone has ever even thought about wanting to see their open belly basically. And I was like, I can appreciate that. So I just laid there so excited. Thankfully, my baby flipped his head down. Even in pre-op, he was transverse. So they were like, we don't know if you're actually going to be able to fully pull him out because we would have to do a breech delivery. But they're like, she was like, I can definitely 100% guarantee you that once he's out, you will still reach down to pick him up and bring him to your chest.
And
But
was that because
thankfully,
of the polyhydramnios? He was just so fluid. He was
yes,
so
yeah.
floaty. Yeah, yeah.
He would never settle into a spot. He would be oblique, he'd be transverse, he'd be head down. He was breech for a while. He did flip, never fully went back to breech, but yeah, if he had stayed oblique or transverse, they were going to have to do the C-section basically from a breech approach. So then I wouldn't be able to actually pull him out. But they were like, once he would be out, you can still reach down and pull him all the way up to your chest. Thankfully, baby cooperated. After the spinal and everything, she checked again and he decided to be head down. So that was amazing. So she kept me up to date where they were throughout the procedure. The anesthesia team was great. They kept checking in on me, asking me how I was feeling, which was fantastic. And then she got the head out and she got his shoulders out and she was like, all right, reach down and pull out your baby. And I was like, oh my goodness. So the anesthesia team helped support my back while I reached down. I got to pull him under his arms. Honestly, the first thing I remember thinking was, oh my goodness, he's so slippery. So I kind of readjusted my grip on him and I got to pull basically from his shoulders all the way out. I pulled him out and I placed him right on my chest. And I remember initially kind of being like, oh my goodness, can I touch him? I don't want to ruin any sterile thing. And the surgeon was like, he's your baby. You can move him around. Like, look at him. And I just remember, like, I was like, this is the best feeling in the world. I got to cut his cord. They honored my wishes. I asked them if they could milk the cord, which they were willing to do. They were willing to delay the cord clamping for the minute, which was the most that they did just because of the placenta starting to detach. But we did that. They even honored to me, which was huge. I had talked to them about like the antibiotics just from the standpoint of the C-section. Although I can tell there wasn't always the most comfort amongst the combined team. Some providers were completely okay with it. Anesthesia didn't have an issue with it. Surgical standpoint, a little concerned just because of infection risk, but she was like, well, if you understand the risks and the benefits, you can make that informed decision. And to me, that meant the world. Because to me, I was like, that is one battle I'm not going to fight. I was like, I understand. And I don't want to potentially cause a situation of I refused them and then had some sort of an infection and then they don't allow this anymore. So I had no issue with that. But thankfully she did. She was like, if that's a risk that you acknowledge, then that's your decision. And so that's the way we went. Thankfully, everything healed perfectly fine. There was no infection or anything, but that meant so much to me of, that's as long as you're making that informed decision, that is your decision. And
like you said, like it is so important to escalate only as needed and not just
yes.
throw everything at it. Yeah. Yeah.
Yeah. So
God,
I got to keep
so
baby
beautiful.
once I cut the cord, and everything, then they pulled the drape up. So, which, whatever, I don't care. I don't have to be a component of getting all stitched back up. But even that was huge. I had a lot of nausea, and I unfortunately still did after my son, but with my daughter, I had a lot of nausea and stuff. So I even asked if they were willing to do like an external repair of everything, or like a repair everything the way I wanted it so that I could hopefully decrease the nausea. And they were willing to. They did a full internal repair on there. Like, it takes a little longer and there's not a whole bunch of, so to say, fully solidified evidence that it works, but there is some evidence that sometimes it can decrease nausea. So I asked and they said yes. And my whole team was all either like fourth year senior residents or full attendings, which was great. I was like, I don't want students. They respected that. And I even asked, I was like, honestly, I was like, I know this isn't something that you guys do a lot. I'm like, so does that mean that there's going to be people that might like just be there to observe, or like, I was like, cause I'm not interested in that. And they're like, nope. They're like, we fully respect your wishes. Plus, since there is a slightly higher risk of infection given just the extra involvement, they're going to want as little people there as possible. So it was just amazing. I got to have my husband there. I got to have our doula there. And it was like the best thing in the world. And then they finished the repair. Entire time baby stayed on my chest. The only time he left me was when they were done doing the repair, and the baby nurse took him over to the warmer just to get his height and weight and all that, while they put me back onto the stretcher to go back to the recovery area. And even that, all the way down to the smallest details, I was like, I don't want you to wipe him down. I don't want you to put his diaper on. I don't want anything to happen because I didn't get to do any of that with my daughter. Some of the things might be so small, of like, you want to put the first diaper on your baby, but I was like, that to me was something I didn't get to do with my daughter. And so they let me. So they were like, he might pee on you, but you can have him. So I was like, that's fine. I don't care if he pees on me. So we went back to recovery. I got to put his diaper and everything on. I did choose to do vitamin K. That was the only thing I chose to do. And even that, they were like, do you want us to do it in, when we do his height and weight, or wait? I was like, no, I'd like to wait. So we did that. It was probably almost an hour and a half after he was born. I got to hold him and nurse him while they did that, which was great. It was the most amazing experience. Everyone was like, we had that newborn baby high. And I was like, it changed my life. I am a whole new person. I had done months and months of like EMDR and postpartum courses for trauma healing and all of the things. And the sad part is, as amazing as it was and as much as I remember it, unfortunately, trauma is a very greedy thing and it sticks in your mind more than the beautifulness. But I can remember exactly how I felt when my daughter was born, and as much joy and everything that I know I felt with my son, I can't bring that moment back as with my daughter. That's
Yeah.
why it's important to minimize that initial trauma, because as much and everything that my son healed, it doesn't make the other stuff go away. And that's so sad.
Yeah, just because you don't have a bleeding wound anymore doesn't mean you don't have the scar.
Yes, exactly. And
Yeah.
for me, I am so thankful to have that standpoint of C-sections can be terrible and your worst, literally with her experience, every fear I had in a hospital transfer came true. Every single one. It wasn't just the doctors, it was the doctors, the nurses, everyone. I had this beautiful experience where every person respected me, treated me with the utmost care and everything. In postpartum, I even had told them before all this, I was like, even in postpartum, I was like, I don't want to be bothered. I was like, just leave me alone. I have my people. I was like, if I need you, I will call you. But otherwise, leave me alone, please, and just bother me as little as possible. Do that cluster care, the everything. And they did. And it was great. I was discharged the next night, which was my request, because I was like, I need to be with my daughter. I can't be here 2 nights. I was like, there was no issues. We're both doing great. So they were willing to discharge me the next day. Plus, I was able to say, I have my home care midwife as well. She is going to see me the next morning after I'm discharged. So I'm not going a single day without care. They respected my midwife, which was great. After my daughter was born and they came in doing our discharge for my daughter, and they were like, yeah, so we wouldn't recommend doing another home birth as a VBAC and everything else. And basically, I spent honestly an hour. It's like, I don't care. I spent an hour and I educated them on how there are policies and there are things and qualifications that you need to meet to be able to have a home birth and different things like that, and how there's different types of providers, and how just because you're doing a home birth doesn't mean you don't get labs and you don't get imaging. And I did not care. I had one provider tell me with my daughter that there's no evidence that supports that position changes and movement can reposition a baby. And I just looked at her and I was like, well, I appreciate your input, but I am not going to take that as advice because it is not true. And as someone who has a background, I research everything. I have a very good understanding of the decisions I'm making with my daughter. I brought up-to-date articles with risks and statistics and everything. And I was like, I make this decision with all this research, honoring the fact of the potential outcomes. And they respected that with my son. And that meant the world.
Well, I mean, what you're describing is just like it's just like core common decency, right? Like, you were at the center, you made your own sovereign decisions, people supported you and treated you with dignity and respect. That is just like basic healthcare, but it's
Yes.
missing. It's
Yes.
completely missing. And that's why this experience was revolutionary.
Yes. Yeah. It's to me, there's just different things I was passionate about beforehand. And again, it's one of those things I go back to, and I was like, the care I provided when I was at the bedside with my daughter was not the care that I received. It made me thankful because when I had my daughter, I was working in an outpatient clinic, so I wasn't as present, but it made me thankful for the bedside nurse. I was open to, if we were doing minor bedside procedures, things like that. I very rarely asked family to step out as long as they were comfortable, patient was comfortable. It wasn't anything emergent. I was always very family inclusive because to me, that means something. The family means something. They're the person's support system and they're their comfort.
Absolutely. The
You know,
family, the family is their root, right? Yeah. When you
yes,
amputate them from your root, like you can watch the plant wither, right? Like they need that.
yes. With my daughter, I advocated, I already had an epidural. That was one of the main reasons why I transferred with my daughter. She was posterior and asynclitic and she just wasn't
Oh yeah.
moving. I
Yeah.
already had my epidural and my nurse was okay. She wasn't great. There was only one nurse, and that was on the outgoing shift. Wasn't even our nurse, just was there helping us get originally settled into our room, that had looked at me and said, I know this isn't what you wanted and it wasn't your plan, but we're going to make the best of it. And that was the first and last time I felt anything like that with my daughter because it wasn't my nurse. It wasn't her shift. First and last time. And I remember asking, I was like, can my husband come back to the OR with me? Which again, realizing isn't necessarily policy or protocol anywhere. They wait until right before they start the case to get your spouse or support person. I was like, I need someone to come with me. I was told no. And the second that I got brought out of my room to go have the C-section for my daughter was the moment I disassociated. And to an extent, honestly, until my son was born, I don't think that I fully came back. I did a lot of work, a lot of
Mm,
reprocessing, but I
mm.
did not fully
Oh, that
feel
just
whole
hits me
again
right in the heart. Oh
until my
gosh.
son, because my daughter was born. I didn't care. The anesthesia provider, she was actually a student, was working with the attending. She actually asked my husband, do you have your phone? I'll take a picture of you guys. I was smiling in the picture, but I didn't want to smile. I remember telling myself, like, oh, I have to smile for this picture. I feel so bad. Like, it makes me feel, while I know it's not my fault and I know all those things now, and there's a lot less guilt behind it, I wasn't the same person. Even with my son in the postpartum period, my husband, he's like, you're such a better mom than, he's like, not that you were a bad mom. And I don't want that to come across as like, he thought I was a bad mom, but you're so much more patient, present, and relaxed. I don't think that's just because it's my second kid. I think it's because of the way
No,
in
no,
which he
no.
was brought into this
Yeah.
world.
Well, and
And
and the effect that that had on you, right? I mean, and
yes,
this is the thing I always try to tell people. I try to say cesarean is not the worst thing that can happen. I promise you. Cesarean is not
yes,
the worst thing.
correct.
Losing dignity, respect, losing control of your own sovereign identity, losing the ability to make decisions for yourself is the worst thing that can happen because it's a form of erasing your humanity.
Yes.
It
Yes.
makes total sense to me that you disassociated because, of
Yeah.
course, you were literally in fight, flight, freeze, or fawn. You were in like a functional freeze for several years because that was the only
Yeah.
way your body knew how to keep you safe.
Yeah. I remember, and this was even before actually transferring, but I remember with my daughter that I was in my bedroom, on the bedroom, my bedroom floor, on my hands and knees. And I remember making that decision to transfer, knowing that's what I needed to, and trusting my body. But I also remember that I was like, that means from now on, I am going to have to fight for the birth I want. Partially hoping that wasn't the case because I'm like, just, thinking of all my fears of the transferring life. But at the same time, I was like, I now have to prepare myself for all the things that I'm very likely going to have to fight for now. And that is what it was. From the second I transferred, and obviously that's not a good spot for your body when you're trying to have a child. That child, is not going to want to be born physiologically normal
Oh, that's
pathway if
horrible.
you're stressed
Yeah,
out and
yeah.
everything. So from the second that I transferred with my daughter, I remember I was like, you know what? I'm like, I am no longer a mom. I'm no longer, someone who's in a calm state trying to have this child. It was like, I felt like I was back at work. I was the person that was advocating for myself, that was having to think of all the medical things and question everything. And I remember my daughter, just because of her positioning and everything, I kept having these tetanic contractions. And I remember the first one was before they had any medications. I had my epidural and that was it. And I had a tetanic contraction. Her heart rate dropped. It came back up. And then I remember it wasn't an hour later that they were like, well, you're not really having any sort of like cervical change or progress. So we need to do Pitocin. I was the only one in that room that was like, this does not make sense to me. My midwife at the time, she was a CPM. So obviously not as much of the medical pharmacological background, but I was the only one that was like, this does not make sense. And I got the typical, well, we need to do something for there to be labor and for this baby to be born. When I was like, this does not make sense to me. But there was no other option. No one gave me any other choice. I did not feel supported in the fact that there was another option other than just a gut feeling. But so I agreed. Long story short, obviously Pitocin did not work because that was not the main issue. That was a big thing for me. I will never let myself feel that way again. I will never just say yes. And that was huge. And from then on, related to babies or not in my health life, I'm like, if I do not get a good feeling, if I do not feel supported and heard, I will find another provider who will listen to me, regardless of how many people I have to talk to or see or share my story with, because I will never feel that again. And it's hard because so many people will unfortunately sustain that and either don't know how to advocate for themselves or don't feel it's worth it because every time they do, they get shot down or don't get heard
Yeah.
or don't have to support them in advocating for themselves or the knowledge of what they need to be advocating for, or even just their basic rights, what they can say no to or can't. It's unfortunate and it hurts me. Ever since then, aside from advocating for, just obstetrical violence and home birth communication and all the things, I have become very passionate about patient rights because
Yeah.
it's gotten that almost like provider feeling of just implied consent or more so just telling you what we're going to do, that it's still a choice. You can, regardless of if it's phrased to you as a question or as what's going to happen, you have the right to ask questions. You have the right to say no. And that to me is something that really needs to be brought to people, like patients' attentions, moms' attentions, anyone of, I had a nursing instructor, and this has stuck with me for years in nursing school. She always said, what are you doing and why are you doing it? And to me, that has stuck true professionally, but also as a patient of what are you doing and why? And if you can't give me a reason why that to me resonates, feels true, and isn't just giving me random information so that I will agree, that is not enough.
It's so essential. People have that support, that education, that clarity, that request, right? It's so, so important.
Yes. Yeah,
Can
it's
can you
something
hear me
that,
okay?
yes, I can. Yes, now I can.
Just 1 second. Ashley, your story is incredible and reminds me of this crisis. And I mean, I know that none of these scenarios is necessarily what you wanted to go through, but I'm just so excited that you've been able to turn your pain into power, that you've been able to transform this into this gift for the patients that you will serve and providers that you will influence. It's just so exciting.
Yeah, it definitely has me very excited for the future. It's hard, honestly. I mean, I'm trying to slow down a little bit in my excitement because I have my 2.5-year-old and my 5-month-old who I still want to be honestly, very present with and enjoy these super young years. But it also has me excited and kind of hard, honestly, to rein in on where I want to start because I have such a vision of where I want to go with this
Yeah.
to figure out where I want to start and which area I want to impact first. But to me, originally I felt so sad, so disappointed. Like, why did this have to happen to me? Like, I don't understand. And
Yeah.
then with my son, all the challenges of trying to figure out things during the pregnancy, every time I would get excited and optimistic for this beautiful, successful home birth, something else would come up in imaging or whatever that posed the challenge of, well, maybe it might not be the best spot. And that's what I loved about my home birth midwife was that she was like, I think sometimes home birth is over glorified and people think that it's the only way to have a beautiful birth. And she's like, there is a time for the hospital sometimes being the better option or better place. And home and hospital births can be beautiful with the right people, the right team, the right plan. And that to me really stuck with me because I feel like a lot of times home birth transfers aren't talked about a lot. They're viewed as failures. They are always presented a lot of times to me in a way of a transfer equals a negative experience or outcome. And that's not how it has to be. And I know she's had a handful of transfers primarily that were not emergent, that were a lot of times just from moms that were tired and drained and just needed some pain relief or just something extra to be able to relax a little bit to then have very beautiful vaginal hospital births after transferring. And that to me, her sharing all of those stories without being biased really stuck with me and was comforting as a client of hers of, she's had this experience. She's had good, she's had bad, things sometimes happen. I remember telling her before we decided to transfer care, I remember her saying to her, it's like, one of the biggest things is that if something were to happen emergently or anything at home, I was like, even though I know it's not the definitive location, I was like, it gives me a lot more comfort, honestly, because I know you will handle that situation with calm poise and information. And I'm not going to be left in silence freaking out because no one's telling me what's going on.
Yeah.
And that to me is another thing. Communication is so much. And I understand that sometimes there's not time in that exact moment to talk about every single thing that's happening. But that debriefing phase is very important. And that's something that honestly, if I had after my daughter, there still would have been a lot going on, but it would have helped to have a provider come up to me and even just acknowledge the fact of, I know that the outcome wasn't what you wanted. How are you feeling about that? Or, these are the cascades of things that happened as to why it was the best option. But, are there any questions you have? Because that was my biggest thing from someone that has medical experience and everything is I needed to physiologically, medically understand what happened, the
Yeah.
labor pattern and positioning and everything. I had to, and I thankfully eventually was able to like piece it all together and consult with, other nurse midwives and stuff to understand it better and also what could have been done to give me a better outcome. But that to me is how I needed to heal. I had to understand what happened. I remember listening to a podcast, I don't remember who it was by, but that made a whole podcast about the importance of debriefing after traumatic events or even just potentially traumatic events because what someone perceives as traumatic, someone else might not. And so to even just
Yeah.
acknowledge the fact that this might not have been a good experience, how do you feel about that? Means so much. And that
Yeah.
type of education is where I would really like to go in the future, educating hospital systems or even just community birth wise. Cause a lot of times, honestly, to me, I was like, both times I paid out of pocket for my midwives and for hospital births through insurance. I was like, and I'm fortunate enough and in a place that I was able to do that. And it meant the world to me. Both times my midwives and extra support, they were worth every single penny. They were the ones who really there that listened to me, that was able to, especially in that postpartum period, do a lot of healing and just support and sharing and processing that. Unfortunately, either people that just aren't open to the idea of home births or just don't really understand it or something along those lines, you don't get that support postpartum. And to
Yeah.
me, that postpartum period, that mental health period, it can mean so much, especially for people who have traumatic experiences. It can be the difference between being able to heal right away and be able to have that time, even if you're not fully present. It can mean the difference between that and
Yeah.
being comfortable versus having severe depression or even needing to be admitted for thoughts
Yeah.
of self-harm. So that importance to me is another focus that I would really like to work on, because it gets lost so much. Not only are you healing from major surgery, but especially if you labored for hours, then your body went through surgery. Now you have this brand new newborn that you have and you take care of, and you're like, I can't even focus on what happened because I just need to survive. And
Yeah.
it's sad. And I feel
Exhausting.
like I missed so much. I look back
Yeah.
on pictures and my husband's like, what do you mean you don't remember it? And I'm like, I don't remember it. Like, there's the picture and there's a little bit of me that remembers certain moments, but I was just kind of there. Whereas with my son, I feel present, and it's an amazing, beautiful gift. There's just no
Mm.
words.
You had a healing experience. You got to be present, wait for the birth of your baby by cesarean and participate. It's awesome. It's absolutely
Yeah,
life changing. I get it. I get
amazing. I
it.
had one of the Facebook pages I'm in, a C-section page for moms. There was a mom actually who posted, she was like, listen, like, I want to have another baby, but my first two were C-sections. I don't think a provider will do a vaginal birth. Plus, for her own comfort reasons with risks and stuff, she's like, I think I'd rather have another C-section. But she asked, has anyone had a maternal assisted C-section? So I was like, I did. And I shared my pictures. And that was one of the things she said to me. She didn't necessarily have any traumatic experience, but she's like, I just want to feel like I was able to be involved in the birth of one of my kids. That resonates with me because, you have your vaginal births, and majority of the time, as long as there's no issues and you have a great hospital birth team, you can have a beautiful vaginal birth where the providers just let you kind of do your thing and are just there to support you. They let you have your moment with your baby and everything, and it's great and beautiful. And even if that was one of my things, even before I was offered my maternal assisted C-section, I remember saying, listen, I advocated. I had asked probably 3 times about it, and both the times I had gotten told it was mostly just that the first one was an old provider of the institution. So, like, it did happen. It was more of a professional courtesy type situation, not a lot of provider support to support the desire, like the demand. I don't think a lot of providers are willing to do these other than the one that did. So obviously she can't do however many and still do all of her other work. My biggest thing I advocate for was, listen, even if I can't participate by doing the full-blown maternal C-section, there is no reason why that baby can't be handed to an OR nurse and then handed straight to me, as long as,
Right.
God willing, there are no complications. That was the biggest thing I pushed for. And that is what I was never going to let go, was that moment. I was like, anything
I love
else
that.
to me was icing on the cake and extra. And thankfully they were willing to accommodate that. and honor everything that I had gone through.
I love that.
But
I
the
love that.
part I was not going to let go was I need my baby. I made that very clear at every single visit and every interaction. The baby needs to be mine because my daughter sat on my lap. They honored the delayed cord clamping. They honored that. But she sat on my lap for the full minute and I could hear her crying. I knew she was okay. She had great ABGAR scores. And I just remember I was like feeling in that moment, like, there is no reason why she can't just come to me. There's no reason why. I was like, they can do their full quick assessment while she's sitting there on my lap for a full minute because I can't see her. I remember even after her, I was like, they didn't even give me what my doula called it a Simba moment. I was like, they didn't hold her up during that minute so I could see her. I didn't see her until after they had, let her sit for a minute, clamped the cord and everything, and then we're bringing her to the warmer.
I'm so
So
sorry.
that was what I was not letting go, was I need my baby. I was like, and if not, I need to know why.
Yeah. And they
And
gave you, and they gave you this option of something even more incredible. I'm
yes,
so glad you claimed it. I'm so glad you did that because I think you're going to be able to advocate for so many other women.
it
I think
was
coming from a nursing background, you're going to be able to advocate for so many providers as well. It's so exciting.
It was one of those things where every time I've spoken with my U of M midwife since, I thank her every time. And every time she was like, it was all you advocated. Like, this was all you. And every single time I turn it back on her and I'm like, I advocated, don't get me wrong, but you are the one who advocated for me, because me advocating for myself, I can unfortunately only get so far. I
Yeah.
was like, so the fact that she really took everything upon herself. I had asked a couple times, I'd asked her about the first one they had done, and each time she was like, I don't think we're really doing them. But so, I mean, I didn't even, but come the end of the pregnancy, I had even stopped asking about them because I was like, all right, they're not doing it. I accepted that and I was okay with that. But so I was like, I didn't get put in this corner where like I made a last minute begging plea of like, can I please have this type of C-section? She took it upon herself to reach out to the surgeon and see if, and explain the situation, how we didn't qualify for our home birth anymore. My, so to say, desperate, desperate way in which I wanted my induction to go and all of the things. And yeah, her taking that on gave me hope. It
That's
gave
so
me hope
beautiful.
that, there are still people, there are still providers open-minded enough, willing to be transformative and listen. Because I mean, I also understand, I'm like, burnout, demand, moral distress, and everything that's going on in the world of healthcare right now, it can drain you quickly of that human approach and empathy and everything. It can drain you so quickly in the world of healthcare. And that is definitely something I always acknowledge to my providers, especially my home birth midwife. I appreciate and I realize the care you provide and the strain sometimes that it might have on your family. I greatly appreciate all the things that you do. Sometimes it's not the client's job or anything to recognize that. I think sometimes that gets lost. And I think sometimes acknowledging that to a provider, it can mean a lot to them. Sometimes when you acknowledge that and are grateful for what they have given you, that can go a long way. And there's been in various aspects of my health sometimes that I speak with different providers and explain to them different anxiety I have or why I might need or special accommodations or just more time, like a slow moving pace, or let me listen to my guided meditation tape while certain things happen, and explain to them the situation and everything. They have more appreciation for it. I explain to them, I say, listen, like, I understand all of the things that go into this. I was like, and I don't want to come off as I had this one terrible bad experience at this other institution, so I deserve and demand this type of care. Because that's not the approach to me that is right either. I do believe that people that have traumatic experiences in birth or any aspect of healthcare deserve special accommodations. I also respect and appreciate that you can't always have every single thing that you want for one reason or another. Well, whether it's just that we're not there yet in terms of evolving and transforming care, or whether it just legitimately cannot be accommodated for sterility reasons or whatever the reason may be. I believe there's a better way, and that people with trauma and poor experiences need extra accommodation. I was talking to my midwife about this not too long ago. I was like, I was talking to my sister about something, and I remember saying, I was like, especially in bigger pediatric hospitals and other areas, regardless if they're major into peds or not, I was like, they have child life specialists. They make a lot of exceptions most of the time in terms of allowing parents back with their kids before surgeries. The parents can stay until their child is anesthetized. There's no reason why, if pediatrics can figure it out, that the world of adult medicine can't. And she brought up a good point. She was like, I think it's because the world views adults as not being as susceptible to trauma or better to cope with trauma because they're adults and they can handle it. And it's just not true. And I was like, but that resonated with me. Like, a lot of times it's like, oh, they're just being immature or babies about certain situations. We're equally susceptible to trauma. There's sometimes a bigger component of minimizing trauma in children, which, don't get me wrong, is very needed. But it's equally important to prevent that initial trauma, regardless of how old a person is, because it impacts their life.
Absolutely.
It impacts everything. And
Absolutely.
the fact that, multiple people close to me are like, you're a whole new person. It's not like it just ended after the first couple weeks of having a newborn, of that little like newborn honeymoon period. Like, my life is changed. And while I still work through different things and different trauma triggers do come up, or I think about different things, and I'm like, why? Like, I think I sometimes, what was it? My husband was like, sometimes you can be like a pessimist or whatever. And I'm like, I was like, when I was younger, don't get me wrong, I kind of always was like a negative Nancy. I'm like, what? It's just going to always be the bad outcome. But I've lost that, but in some ways kept it. And I just had an epiphany not too long ago. And I was like, why? I think even during the pregnancy with my son, when different things were found, I always prepared for the worst. I was like, that's just what's going to happen, because that's what it's going to be. And I was like, why? I think I've had that thought process, and it took me until now to figure it out. Was I'm like, because that's what happened with my daughter. I prepared for the worst, had all these worst fears, and those are exactly what happened. So no matter how much U of M and their amazing team did for me, anytime something comes up, I'm like, it's just going to be the poor outcome. Because on and off since then, I've even just recently spoken with a doctor's office and was very easily and quickly dismissed and treated improperly, in my opinion, very quickly transferred offices and teams, and have a brand new, wonderful team of people that I'm working with. And it's, I had this great experience. I had this horrible experience. Then I had this beautiful experience. And then I went right back to having a bad experience with a different department and institution that forced me to advocate again for myself and find this, again, beautiful team of people. And I remembered, I told my husband, I was like, it should not be this hard. People should not have to fight this hard. And not everyone's going to, because it's hard. It takes time to, I spent an entire day calling offices, speaking to 4 different institutions of options, things like that. And I'm like, it should not be this hard, because people need care and people deserve to be treated with respect and compassion. And I was like, I guarantee you, I won the most annoying patient of the day award in that office, but I don't care. To me,
Absolutely.
my terrible experience gave me that. And for that, I am appreciative because it really made me aware to sit there and say, I am not settle for anything less than what makes me feel comfortable and confident in my team. And
Mm,
that,
that's it.
even just
That's it
that,
right
has
there. That's it.
such
Yeah.
an impact on healing and
Yeah.
like emotionally and physiologically. It's
Yeah.
my
Oh,
daughter, the smallest thing made me feel like a terrible mom, a terrible wife, made me so depressed. With my son, it's like, all right, take a deep breath. Like, it's going to be okay. We'll get through it. A whole new approach. And
mm,
it's just jaw-droppingly amazing. When he
mm.
was born on my chest, I sat there. This was the right decision. I felt all the feelings. Absolutely amazing. I was nursing him during the closure of my C-section.
Amazing.
It was
Amazing.
just the most beautiful thing in the world. The anesthesia team was there, but they didn't really bother me. Anything I needed. I wanted to be able to see my monitors. They made sure they were angled so I can see them from the table. They did not give me medications until they told me what they were. And again, it's coming from a little bit different of a standpoint. I had some experience with some of the different medications and things like that, but I was like, I want you to tell me what you're giving me, what it does, give me options. With my daughter, I remember them handing me pills and they're like, here you go. I'm like, well, what is it? I was like, I'm not like things like that. I didn't have a whole bunch of bleeding, but it was more of a precautionary borderline bleeding thing with my daughter. I remember them asking for TXA and Pitocin and all the things. And again, with my background, knowing what they're for, I remember kind of freaking out. I was like, why? What is going on? No one said anything to me. By that point, I was so just kind of paralyzed. I didn't even say anything other than look at the monitor and was like, am I okay? Whereas with my son, every single thing was told to me and it made me more comfortable. I felt I could trust them. And I was like, you know what? Even if whatever happens, it's going to be okay because it's going to be handled better. While there will still be some trauma that I would have to work through, it's not going to be anything like my last experience.
Mm.
To me, that was huge because, again, I keep going back to the fact of my daughter's birth was not physiologically, not clinically super traumatic from my own interpretation. It was the treatment. And
Right.
I think a lot of,
That's psychological
yeah,
abuse, really. Yeah.
yeah. And so I think a lot of people are like, think that people can only suffer trauma if there's a negative outcome physiologically or clinically. And that's just not true. And I have a lot of things and a lot of ideas that will they change in my lifetime? Who knows? Because the world of medicine, I'm 30, but the world of medicine is so hard to change. But I think more and more people are starting to become more open-minded and more in tune to change, hopefully. So we'll see where it goes. But to me right now, I want to do a lot of work, but it's just as important to share my story because I feel like it is happening in the US. I feel like there have been like onesie twosies, kind of like my situation, where they're being done, but not really.
Yeah.
And I don't know specifically what the reasoning for that is. I don't know if it's just because there's not a lot of providers willing to do it. And there's not I know Dr. Cohen in the Netherlands, like that's all he does primarily. I
Right.
don't want to say all
Right.
because he does other work as well, but that's kind of what he's known for are these maternal assisted C-sections. I don't know if it's just that the providers that are doing them here in the US have the empathy and the compassion and everything that they're willing to do them, but they don't necessarily want it to be their life's work. I don't know what the gap or the blockade is, but my point is they're being done. They're just not being heard about. And I think
Yeah.
if they're heard about more, that they are being done, unfortunately, after lots of advocacy, fighting, searching
And
for the right
trauma. And
provider
trauma.
and trauma.
Yeah.
Yeah, a lot of the people, it's, unless you have trauma, you don't get the special care.
Yeah.
And a lot of times the special care can prevent the trauma.
Oh,
And it's
that's
something I think of, I'm like, why did I have to have this terrible experience to be able to now have, for various different things, biggest one, the birth of my son, but why do I have to have this trauma to be able to be then viewed from other aspects of care as this person has trauma, they need this care, this treatment, these exceptions? Because if they can be made because I have my trauma, then they can be made for anyone. It's just that there's less of a desire, in my opinion, for them to be made. So it's like, if we can do this and it's safe enough for someone to have a support person during ultrasounds or a support person during a procedure that's minor and whatnot, we just have to make sure that the support person understands where they can be and what they can do, or in this case, a giant amazing C-section.
yeah.
It's if we can make exceptions and we can make things happen for those with trauma, while they are greatly appreciated, then we can make it happen and it can be a normal. It's just that I feel like it makes people uncomfortable, especially in the healthcare world. It makes them uncomfortable of being more exposed, more people kind of being there, of not having that control. And I think it's a big control. That's what it was. I mean, for my pregnancy, that was the thing, was like, I needed to feel like I had control. And I think a lot of times providers and healthcare systems and policies and procedures, that's where the control lies. There needs to be a big readjustment and rebalancing of how that all works, because
Well, Ashley, thank God that you're coming onto the scene because people, they need you. You're going to be one of those patient and nurse advocates that changes it for the better. It's
yeah, I
so
I
exciting.
hope so.
Thank you. Thank you. Thank you so much. And thank you for taking the time to tell us your story in all of its detail. It's so fascinating. We
Yes,
would love to put some links up so people can connect with you. Are you open to that?
most certainly.
How will
So
people find you online?
yeah, so kind of a side note, is not part of this, but so I actually was honestly just about to make a first post for my Instagram page. My plan is to call it Birth on Her Terms.
Beautiful. Beautiful.
And my plan is to start sharing post by post here and there when I can with the kids, of my starting with my birth story of my son, and hopefully going back and talking a little bit then about the balance of care and basically everything we talked about over the course of a few posts. I plan to start sharing a lot of Cohen stuff from the Netherlands. He's doing a lot of amazing
Awesome.
research.
It's so cool.
Yeah. I feel like a lot of people in the US don't really know much about him unless you go searching on a journey like I have, about knowing this is
Yeah.
being done in other places. I am very, very excited and hoping to get a lot of followers and support on that. Thank you so much. And thank you so much for
It's been
sharing
a
my
pleasure.
story.
I'm
Yes.
so glad you did. It's going to be well received. Thank you. Thank you. Have a fantastic day.
Thank you. You too. All
Bye.
right. Bye.